Hi, my name is Dr. Laura Robotham, and I'm a medical resident at Kearney Hospital in Boston, Massachusetts. Today, I'm here to talk to you a little bit about blood pressure. We all know that high blood pressure can cause us health problems, but what types of health problems might it cause, and how does it really work in our bodies? Let's look at this clip together to understand a little bit better the basic mechanics of the heart and its pumping function and the role that our vessels have in our health.
Father. Emma is one of the 67 million adults in the U.S. with high blood pressure, or hypertension. Just like her radiator that's on the fritz, Emma's heart is working overtime to get the job done. Let's have a look. The heart is the pump in our bodies, delivering blood to the entire system through a set of pipes, or blood vessels of all sizes. Smoking, high cholesterol, diabetes, obesity, physical inactivity, family history, and increased age all contribute to these blood vessels, or our pipes, becoming less elastic. The more blood our heart has to pump through stiff, narrowing arteries, the higher our blood pressure. When the force of the blood against our artery walls is too high, life-threatening health problems can result. Problems like kidney disease, heart disease, stroke, even heart attack. Can Emma get her pressure down before it's too late?
Now you know that having high blood pressure can increase your risk of things like stroke. What can you do to lower your risk of having high blood pressure? It's important for you to take preventative steps, like making sure that you get the amount of exercise advised by your physician. Please take a look at this clip and we'll learn more about what you can do.
On September 4, 2012, CDC released its 25th issue of Vital Signs, a monthly call to action concerning a single important public health topic. This report focuses on the issue of blood pressure control. In the United States, more than 1/3 of the adult population, or approximately 67 million people, have high blood pressure. Of those with high blood pressure, more than half don't have it under control. High blood pressure makes you 4 times more likely to die from a stroke and 3 times more likely to die from heart disease. What is high blood pressure and how do we improve control? Normal blood pressure is where your systolic pressure, or the top number, is less than 120, and your diastolic pressure, or the bottom number, is less than 80. If you are below this level, make sure you check your blood pressure at least twice a year. If your pressure is 120 to 139 over 80 to 89, you should monitor it closely and make healthy lifestyle changes. If you have a pressure of 140 over 90 or higher and you are not already being treated for high blood pressure, seek medical attention. If you are being treated, make sure to take your prescribed medicines. Ask your healthcare provider to check your blood pressure during visits.
So now you understand the numbers that your doctor is looking at when they're determining whether or not you have high blood pressure or if you're at risk of developing high blood pressure in the future. So what can you do to help prevent having high blood pressure in the future? Let's take a look at this video and learn a little bit about the requirements for physical activity in order to reduce your risk.
The prevalence of overweight and obesity has tripled in our children. I want to live to see her graduate and have children.
And if they see, dad exercising and eating healthy, I think they have a much higher chance of going that route themselves.
Well, physical activity is really good for prevention of weight gain, and it's also good for weight loss if you adjust the calories that you eat accordingly. The minimum level of physical activity to get health benefits is 150 minutes of at least moderate intensity physical activity a week.
When I started, I just added 15 minutes of walking 3 times a week.
You can start low, you can go slow to try and achieve the 150. You don't have to achieve it all in one day.
In fact, as little as 5 to 10% weight loss over time can really reduce the risk for heart disease and high cholesterol and high blood pressure, and even diabetes as well.
So we can see here that we can increase our physical activities levels little by little to finally get to 150 minutes per week. Those are the recommended guidelines at this point in time. What else can you do to help lower your risk? Let's take a look at this video about salt and the impact of salt in our diets.
Facts: Americans consume too much sodium. Sodium raises blood pressure and puts you at risk for heart disease or stroke. What's too much? Most people consume more than 3,400 milligrams a day, but less than 2,300 is recommended, even less for others. A lot of sodium is hidden in processed foods, not the salt shaker. A regular sandwich can have over 1,500 milligrams of sodium. Guess what? Add a can of soup and you're over the limit. Here's what you can do. Buy fresh, frozen, or no salt added canned vegetables and eat more fruit. Use fresh poultry, fish, and other lean meats. Use low or reduced sodium items and limit sauces and mixes. Choose wisely when eating out. Restaurant food can be high in sodium. Ask for low sodium options. Most importantly, learn to read nutrition facts labels. Less sodium, better health.
This has been Dr. Laura Robotham talking to you today about high blood pressure and about lifestyle changes that you can enact today in order to decrease your risk of having high blood pressure or decreasing your blood pressure through lifestyle changes if yours is already elevated. Remember that these changes might seem simple, but it's very complicated to be able to enact all of these changes into your life at once. So we'd encourage you to work with your physician in order to work on these changes one by one. Remember that your health is your wealth, and thank you for joining me today.